Is the sun good or bad for us? Should we try to get outside as much as we can? There's a lot of stuff about vitamin D, and but then you have sunburn. How do we handle the sun in a healthful way?
Yeah, that's a great question. So overall, I think the sun is great. We're designed to be out in the sun. People who are not exposed to the sun get depressed, but you can go the opposite side. You can go and get way too much sun exposure. So so the way to protect against that is get a sunscreen. If you go outside, get a sunscreen that's non-toxic. And what are examples of non-toxic sunscreens? Zinc. Zinc is not going to hurt you. But unfortunately, if you just go to your local store and buy a sunscreen, they're loaded with all these petrochemicals that are toxic. So I know doTERRA, there are other companies that produce safe sunscreens. But overall, I want you to get out into the sun. But guess what? UV radiation from sunlight is definitely aging to your skin. So you do want to have some type of blocker. And Michael, unfortunately, I find even here in Florida, I've met roofers, carpenters who are out without a shirt, throughout the year, getting sun all day long. They're deficient in vitamin D, which is a fat soluble toxin. I can't explain why, but I think it's related to fatty toxins in our environment. So even if you're out in the sun, which I want you to be, most of us are deficient in vitamin D. Most of us need to supplement in vitamin D. And the way you find out is you check your level.
Great. Our next question is coming from Ron. Ron, please state where you're from and ask your question.
I'm from Santa Cruz, California, and I appreciate your comment about hips because I worked with Dr. Robert Cathcart on his hip prosthesis, and he later became an expert in vitamin C with the Linus Pauling. And one thing that happened with aging, of course, is that vitamin C levels decrease, and there's a lot of deficiency in vitamin C, first in elderly and secondly in hospitals, where under stress, people do not get even tested to see what their vitamin C levels are. And so I am curious if you would say just a word about what Dr. Stone called subclinical scurvy.
Yeah, Ron, I agree with you. Vitamin C is a very important vitamin for many reasons, and it's a water-soluble vitamin. So unlike vitamin D, you have to be taking it in all the time. My favorite sources of vitamin C are going to be fruits and vegetables. I will give some of my patients intravenous vitamin C if I'm trying to stimulate their immune system. But that's one of the reasons why you want to eat plants, because if you're eating plants on a regular basis, you are going to be getting enough vitamin C. But I appreciate what you're saying about subclinical scurvy. And the other thing I see with patients who are mold toxic, they can't absorb the vitamin C. So the mold trichothecene toxin, black mold toxin, will sit in the gut and prevent absorption. But to me, one of the important reasons why you want to eat lots of plants every single day is you want to make sure that you keep your vitamin C levels, because vitamin C is one of these key vitamins for the health of your immune system, frankly, every cell in your body.
Great. So I wanted to ask you about, you talked about infrared saunas for detoxing. Is that safe to do every day? Is it something that you would recommend if somebody has access to an infrared sauna, that they do it every day?
Yeah, I am a fan of infrared sauna every day. I'm a fan of traditional sauna every day. I will say with infrared, one of the dangers with some of the infrared saunas is a large amount of EMF radiation exposure. And the only way to check is you can get an EMF monitor or detector and bring it in with you to the sauna and just see if it's shielded or not. But if it is shielded, if you're not getting blasted with EMF, I'm a big fan of daily exposure, because that will improve your lymphatic system It'll basically improve your microcirculation, both your capillaries and lymphatics, and it'll get you sweating. It'll get these fatty toxins moving.
Great. And on the other end of the temperature spectrum, cold plunging or just even going into nature, not even when it's necessarily cold, but going into lakes and oceans, is that healthy? And then also when it's cold, going in and kind of getting that cold plunge effect. What are your thoughts on that?
I love it. Yeah, cold plunging is good. Heat is good. Alternating hot and cold is amazing. I remember doing that at Hippocrates. One of the keys is if you're going to do hot and cold, you want to end on the cold. But this goes back to the concept I mentioned called hormesis. You're stressing your body. And I would recommend doing this every day, going from hot to cold. Biochemically, it sounds weird. Whether you use heat or cold, you're stimulating these basic energy pathways called the heat shock protein. Who would have thought that going to a cold plunge is going to stimulate your heat shock protein? But they first identified that with heat. But it turns out that this will improve the health of your mitochondria, which in turn will improve your energy production and your ability of your mitochondria to help with detoxification. So yes, I'm a big fan if you have access to those things.
So would taking a hot shower and then turning it ice cold at the end, that kind of that shock effect, that's beneficial?
Yes, it is. I would recommend that strongly.
All right, great. And our next question is coming from Mary. Mary, please state where you're from and ask your question.
I am pretty local to you. I live in St. Petersburg, Florida. And my question, I don't know if you've answered this, is about dry eye. I heard you talking about glaucoma, but do you have anything to help with dry eye? And also, if you lose weight and your skin how to return elasticity to your skin?
Yeah, let me start with elasticity first. What we're finding is if we can get people to reverse their biologic age with supplements like NMN, that often the dry skin is getting better. I'm a big fan of moisturizers and essential oils for doing that. Now, dry eye, I've also, it depends why your eyes are dry, right? I mean, if you've got a viral infection, then, maybe an essential oil like Melissa would help. I'll be upfront. If I've got someone with a dry eye, I would send them to an eye doctor who's open to some of these holistic ideas.
Great. We're going to take a question from Bin Wu. Bin Wu, please state where you're from and ask your question.
Yeah, hello, good morning. Thank you for your time to give us education. I'm from the Maryland, Baltimore. My question is, I heard you said maybe it's better to eat the 1 day, 1 meal. So what is good for the aging? And so what time is the best to eat this meal?
Yeah, Ben, great question. I think it's I don't think there's a right answer or best time for everyone. I would experiment and see what works out for you. I know personally, the best thing for me is to skip breakfast and lunch and just eat a large early dinner. But there are other people who will eat a large meal at 6 in the morning and that's all they do. So what I would suggest you do is experiment with the timing. And because obviously eating food is really dependent on your own schedule if you go to work or what have you. I could see theoretically if you could do both, maybe eating first thing in the morning would be better. But to my mind, if you're only eating 1 meal a day, you're amazing. And it is so good for your health because here's the key concept. If you're only eating, let's say over an hour, that gives your body another 23 hours a day to recover, because not so much our audience here, but when the general public, when they eat a large fatty meal, that is causing damage to blood vessels. And if you're giving so I've seen people on YouTube, you can find them, people who eat this huge, amazing meal of unhealthy food, but they're only eating it one time a day. That gives their body 23 hours to recover from all the damage that they're doing. But to go back to your answer, or your question, I should say, I would experiment and see what works out best in your lifestyle.
Great. And besides NMN, what are the other important nutritional supplements that you recommend? I believe you touched on a little bit on that.
Yeah, I mean, I would probably give you a couple dozen, but let me just focus on the two. The way to remember, they both start with N. So NMN and nitric oxide. That's where I would start. You can find on my website other things that I would look at would be creatine, which is an oral supplement. I would also look at fatty 15. I would also look at urolithin A. I would also look at, well, I could go on. I mean, I think the other important point is, instead of starting a dozen supplements all at once, start one at a time to know, because these are powerful supplements. I will also say that I recommend, if you start NMN, that you also start trimethylglycine. If you start NMN 1,000 milligrams, also start trimethylglycine 1,000 milligrams. And the reason for that is, when NMN gets metabolized, it needs methyl groups to be broken down. If you don't supply it and you're deficient, that could hurt your methylation systems in your body. But Michael, literally, I mean, it's hard to just come up with to tell. But I'm excited, and I take all these supplements because I notice a difference. And but again, to keep it simple, focus on nitric oxide and NMN. Yep.
And what are great sources of nitric oxide in the foods that we eat? What would you recommend?
Yeah, I would recommend leafy greens. And again, I would re-emphasize, you want to chew and chew and chew your leafy greens, because there are two places nitric oxide is produced. It's produced in the mouth by bacteria when you chew. It's also produced in the gut. The other trick I'll add is, I recommend tongue scraping, because there's studies that show, for people who scrape their tongue, it improves the number of bacteria that will fix the nitrogen from your nitrates that you're chewing leafy greens to produce the nitric oxide. So chewing and tongue scraping are key to increase the yield of your nitric oxide in your mouth.
Okay, our next question is coming from David T, and we just have about 2 minutes to ask the question and answer the question. So,
Okay.
David.
Okay, I'll be really quick. Can you use the Gallery test to also monitor people who are undergoing cancer treatment to make sure the treatment is effective? And secondly, have you ever heard of the Grease test that gives custom individual plans to treat cancer based on a blood test?
Great questions. And very quickly, the Gallery test is not intended, and I wouldn't recommend it if you have active cancer that you're monitoring. But I definitely do recommend the Grease test, called RGCC. But there's a good company in this country that has non-traditional testing for cancer too. So yes, I definitely recommend the Grease test, but I don't recommend the Gallery test for people with active cancer. It's intended for detecting new cancer, not monitoring. But who knows, maybe the company will come up with a test to monitor it. But right now, I like RGCC in Greece for that type of test, which monitors cancer stem cells in your bloodstream.
Okay, and we've got, I think, enough time for one more. Your thoughts on oils? Are you for or against them? And if you like them, are there some that you find that are beneficial?
Yeah, in terms of, let me be clear, I'm not in favor of adding oil to your diet in general, but essential oils, I'm a big fan of many of them. Again, that would be a whole lecture for a couple hours. My favorites would be lavender for sleep and frankincense for overall anti-inflammation. But again, I could rattle off grapefruit. And also for metabolism, I'm a big fan, as I mentioned, of MetaPower META PWR from doTERRA, which is a blend of cinnamon and lemon and grapefruit and these others that will increase your metabolic rate and prevent the clinical studies now showing that it will prevent fat cells from growing in size.
Okay. So with that, we're going to end our Q&A, and I want to thank you. And if we could please open up unmute the audience.
Thank you very much. You give
Thank you so much.
Yeah, good doctor. Thank you.
Notes. Thank you.